Have you noticed how trendy it is to talk about food and nutrition? Maybe you've seen that advice on food, nutrition, and wellness is nearly everywhere you look. From billboards to magazine articles, Instagram influencers to celebrity chefs, everyone has an opinion on what you eat, when you should eat it, and how much of it you should have. It's possible that our nation's seeming fixation on food and the consequences of eating too much, too little, or the wrong kind is what got you interested in nutrition and dietetics in the first place. In September of 2018, 6 of the top 10 books on the New York Times bestsellers for health were directly related to diet and nutrition. 3 of those books were cookbooks, and the other 3 were diet books that include recipes. Those 6 books were the Whole30 Cookbook, the Lose Your Belly Diet, Medical Medium Life-Changing Foods, Green Smoothies for Life, the Zero Sugar Diet, and the 10-Day Green Smoothie Cleanse. Over the past 10 years, mass access to food documentaries through platforms such as Netflix has served as another way that the media and the public have demonstrated their fascination on this subject, and in the process turned countless consumers into quote-unquote nutrition experts. These documentaries have done a great job of increasing awareness to the role that food and nutrition play in overall health. Unfortunately, they often conclude with an overly simplified message for how to fix the problem. How many of these documentaries have you seen? Food Inc., Forks Over Knives, Super Size Me, The Magic Pill, Fathead, King Corn, Hungry for Change, A Place at the Table, Vegucated, Ingredients, The Local Food Movement Takes Root. Not only is the public fixated on food as it relates to health, there is also a significant increase in the interest surrounding preparation of food. Entire TV channels are dedicated to all things food and cooking. Food Network, the Cooking Channel, just a couple of examples. Major networks also feature primetime slots dedicated to the culinary arts. These include things like MasterChef, MasterChef Junior, Chopped, Hell's Kitchen, Kitchen Nightmares, and the list goes on. Famous chefs have become household names and enjoy celebrity status. Many even have their own cookingware lines sold in popular department stores. Affluent members of society pay large fees to attend cooking classes and learn how to cook like a chef. And individuals shopping for new homes often have a chef's kitchen as one of their top priorities. So, what does that mean? It means that now is a fantastic time to be in the field of nutrition and dietetics. The public is aware of the important role that food plays in prevention and treatment of disease. Their eyes and ears are open and they are looking for direction. It's our job to provide that direction. We can capture their food enthusiasm and teach them how to incorporate appropriate medical nutrition therapy for disease prevention or treatment into their current culinary practices. As registered dietitian nutritionists, we follow the nutrition care process when providing care to our patients and clients. The nutrition care process, or NCP, is a systematic approach to providing high-quality nutrition care. It is designed to improve the consistency and quality of care for patients or groups, as well as the predictability of their outcomes. There are 5 steps in the NCP: assessment, diagnosis, intervention, monitoring, and evaluation. Practitioners can remember each of the steps of the NCP by using the acronym ADIME. Culinary nutrition fits into the NCP, the intervention stage. It is a tool that we can use as we assist our patients and clients in intervening to prevent or treat disease. How do we do it? Do we just jump right in with each and every client and try to tell them not only what to cook, but how they should do it? No, it doesn't work exactly like that. As practitioners, we can use our clinical judgment to identify how ready a client is to make a change. One way we can do this is by using the trans-theoretical model of change. Based on more than 15 years of research, the trans-theoretical model has found that individuals move through a series of 5 stages in the adoption of healthy behaviors or cessation of unhealthy ones. These stages are pre-contemplation, contemplation, preparation, action, and maintenance. In pre-contemplation, the individual has no intent to change behavior in the near future. They do not recognize or acknowledge that there is a problem. In the contemplation stage, the individual openly admits their intent to change, usually within the next 6 months. They are aware of the benefits of change, but are also keenly aware of the costs. In the preparation stage, individuals start taking steps towards the change, and they intend to make a major change within the next month. This is viewed as a transition stage rather than a stable one, as change is imminent. In the action stage of change, the individual has made overt, intentional lifestyle changes, but they've maintained those changes for less than 6 months. In the maintenance stage of change, the individual has maintained their changes for more than 6 months and is actively working to prevent relapse. The idea is that the individual moves through the stage of change in a linear fashion until they reach the maintenance stage, at which point they could relapse into any of the former stages of change and resume the process from that point. Once we have identified in which stage of change our client currently finds themselves, we can then determine how to incorporate culinary nutrition into our nutrition intervention. Let's take a look at how this might occur. In the pre-contemplation stage, we could encourage the client to attend a basic cooking class where the emphasis is on fun and the social aspect of food and cooking. In the contemplation stage, we can encourage the client to attend a basic cooking class that has an aim of introducing them to the kitchen and building their culinary confidence. In the preparation stage, we would encourage our client to attend a cooking class where the concepts will be introduced that fit into a specific desired dietary profile. In the action stage, we would encourage our client to attend a class that has targeted recipes to introduce or reinforce desired eating habits. And in the maintenance stage, we would provide our client with skill-based instruction aimed to enhance their previous knowledge. As you can see, at each level, the client is attending a class with a culinary focus, but as they progress through the stages of change, the focus becomes more clear and the concepts that are introduced and reinforced include more targeted dietary intervention. Despite the previous example, culinary nutrition doesn't always involve a cooking class. In fact, most of the time that an RDN will use culinary nutrition isn't necessarily in the kitchen at all. It's when working one-on-one with a client. The following are just a few brief examples of how you, as a future registered dietitian nutritionist, could use culinary nutrition skills to make a positive impact in your clinical practice. In both of these examples, the client is either in the preparation or action stage of change. In the first example, our client is having a difficult time understanding portion sizes and keeps a very busy schedule. They wish to meal prep on the weekends to prepare for the coming week. You, the RDN, realize that cooking equipment can be used for multiple purposes and recommend that they use a muffin tin to pre-portion and prepare veggie and egg omelet cups that they can store in the refrigerator and heat up in the microwave during the week. Another example takes a client who has just been referred to you by his physician due to obesity and hypertension. The physician wishes for the client to follow a Mediterranean diet, and so the client has been eating a lot of takeout, pasta, pizza, and gyros, and drinking excessive amounts of wine. After all, these are all foods that can be found in the Mediterranean. You work with a client to understand what the Mediterranean diet actually entails, and then you help them to develop basic cooking techniques, including baking and sauteing, as well as how to enhance flavor with herbs and spices so that less salt is necessary. A final example would be a client who comes to see you after being diagnosed with celiac disease. They are so overwhelmed with the prospect of going gluten free, and they don't understand that gluten isn't the only word they will have to avoid on an ingredient label in order to stay safe. They're also frustrated that they will have to give up favorite foods now that they can't have gluten anymore. You work with the client on identification of hidden gluten in food labels and discuss the best gluten free flours and baking techniques in order to create baked goods with acceptable appearance and taste.